MCD Squared, Memory Care for Those with Developmental Disabilities by Group Number 2. The purpose of our program is to provide adults with developmental disabilities exceptional care and awareness of services that meet their needs, which will allow each person to reach their own level of potential independence. Our program goal is to enhance the long-term health of those with developmental disabilities by increasing awareness of services and allowing access to mainstream memory care services. Factors that influence the program outcome and objectives include access to affordable health insurance and the number of memory care facilities near families and individuals needing memory care services. Other possible factors may include nursing workload, quality of care for the residents, and number of specially trained staff. The study objectives we have chosen are outcome objective, behavior impact objective, and process objective. For outcome objective, it is to increase the utilization of at least 2 memory care services provided by NUA homes for families caring for individuals with developmental disabilities. For behavior impact objective, it is to increase the utilization of memory home care centers for individuals with intellectual and developmental disabilities for the estimated 800 people with a developmental disability in need of memory care homes in San Diego. For process objective, it is to increase the number of facility homes from 8 to 15 by 2025. This expansion will nearly double the capacity from 70 to 130 adult residents with intellectual and developmental disabilities. The conceptual model we have decided to use for our program is the socio-ecological model. This model has various levels of prevention, so we have decided to focus on 2 levels, which are the community level and the public policy level. At the community level, we have it broken down into the institutional factor as well as the community factors. In the institutional factor, we want to increase the number of memory care facilities that support those with developmental disabilities in the county of San Diego. For the community factors, we want to increase the relationship with San Diego Regional Center and Alzheimer's Association to provide a support network for NOAA home residents. For the public policy level, we intend to merge memory care with developmental disability individual service plans. The advantages in using the socio-ecological model is that it examines relationship between multiple levels of influences, including individual, community, and societal, as well as concept and behavior is influenced due to direct and indirect behaviors of a person. The disadvantages are that the levels of influence are interconnected and may be difficult to focus on separately. Also, other models may be more useful in developing programs that are aimed at a certain specific level of influence. The main outcome is to increase the utilization of memory home care centers for individuals with intellectual and developmental disabilities for the estimated 800 people with a developmental disability in need of memory care homes in San Diego. In order to measure our outcomes, we will be collecting qualitative data from the families of NOAA homes residents. This will include data collected from observation and interviews. The families of those with developmental disabilities have overseen the majority of their lives and are able to provide feedback of the quality life change experience from our program. In terms of quantitative data, we will use an ordinal level of measurement to measure our resident satisfaction with the merger program of developmental disability and memory care. We will do this by levels of satisfaction with different components of the joint program ranging from highly dissatisfied to highly satisfied. We will also use a ratio measurement to determine the number of services families we are able to utilize. Examples of survey questionnaire. Main outcome, to increase the family's utilization of at least 2 memory care services provided by NUA homes. Example 1. I believe that memory care services are accessible for me or my family members living with a developmental disability. Strongly agree, neutral, disagree, strongly disagree. The response is ordinal. Example 2. Main outcome, to increase the family's utilization of at least 2 memory care services provided by NUA homes. How many memory care services was your family able to utilize for the family member affected with a developmental disability? The response is ratio numerical. We have chosen a post-test quasi-experimental research design. Given that our program is an ongoing program, measurement periods would occur every 3 months along with the individual's quarterly review. The advantage of this design is that it allows researchers to explore a rising issue and have the opportunity to attempt to determine a possible cause and effect relationship to gain further knowledge. The disadvantages is the lack of randomization and lack of ability to control confounding variables that could lead to a decrease in the internal validity of the program. We hope you enjoyed our presentation. Thank you for your time.